This is the ZBS Radio Network.
I want to talk about musculoskeletal stuff here, and I want you to get a hold of the book Epigenetics, The Death of the Genetic Theories of Disease Transmission, the book Dead Doctors Don't Lie, and the book Rare Earth-Been Cures. And musculoskeletal stuff covers a wide range. Okay, we're talking about osteopenia, osteoporosis, periodontal disease, osteoarthritis, degenerative arthritis, bone-to-bone arthritis, rheumatoid arthritis, bone spurs, kidney stones, fibromyalgia, lupus. Let's see here, peripheral neuropathies, which includes atrial fibrillation, irritable bladder syndrome. The 12 cranial nerves, and there's more. Okay, these are just some of the well-known ones. Okay, so what goes on here? Well, musculoskeletal diseases are not genetic. They're not due to age. They're due to only one thing: nutritional deficiencies. Okay, your bones require all 90 essential nutrients. Your tendons, ligaments, connective tissue, cartilage require 90 essential nutrients: 16 minerals, 16 vitamins, 12 amino acids, 3 fatty acids. In the medical system, again, thousands of failed medical theories every century. In the 20th century, 21st century is no different. They want you to believe that you build your bones up until you're 28 years old, and then after that it's all downhill. Well, that is, if you don't supplement properly, you're going downhill as your bones are being formed in your mom's uterus. Kids are born with osteoporosis. It's called osteomalacia in baby. They just gave it a different name. Okay? And so what goes on here? Well, first of all, your bones have rebar in it. It's called bone matrix. Makes up about 75% of the bone weight. You can actually do a Mr. Wizard kind of experiment. Get a bottle of white vinegar, a quart bottle of white vinegar, and eat all the meat off of a roasted, not fried, chicken drumstick. Put the cleaned up chicken drumstick into this quart of white vinegar at room temperature. You have to pour out maybe a couple ounces to get that bone in there. Put the top on it and just leave it out at room temperature on the kitchen counter for a month. After the month is up, open up the jar or the bottle, take out that chicken drumstick bone, and you'll be able to tie it in a single knot, because all the minerals, including calcium and phosphorus and magnesium and boron and strontium and all this other stuff, has been leached out by the acidity of the vinegar. And what you have left is this bone matrix, which makes up 75% of the bone weight. Now, as you lose minerals out of your bone, in living bone, the bone actually becomes larger, thicker. And that's to try and make up for lack of strength when you lose the minerals out of the bone. And so the bones get bigger in diameter. The canals that nerves come through and blood vessels come through get filled up with this bone matrix. Your bone marrow cavity gets filled up with connective tissue and squeezes out the cells that make platelets for clotting, squeeze out the cells that make white blood cells for dealing with infection, and squeeze out the cells that make red blood cells. And so it's not unusual for people to get thrombocytopenia, where you have reduced platelets, and you're starting to bleed all over the place, nosebleeds, and you see this a lot in kids and also in adults of various ages. And, I went to the doctor, and they burned all the capillaries in my nose. Well, that's not solving the problem, because it's solving the symptom, but not solving the problem. Okay? And then you get the white blood cells that are manufactured in the bone marrow. The cells that manufacture them get squeezed out, and you get leukocytopenia, okay? And then you get anemia, because the cells that make red blood cells get squeezed out. And this is all because you have a mineral deficiency, or a vitamin D3 deficiency, or vitamin A deficiency, or vitamin C deficiency, or vitamin K2 deficiency, and deficiency of all 60 essential minerals, right? And then, of course, you can get loose teeth and receding gums, because doctors forget that all the bones in your skull are susceptible to osteoporosis too. And when that happens, not only do you have loose teeth and you lose your teeth, receding gums, but also you'll wind up with pain in your face, which is due to trigeminal neuralgia. The fifth cranial nerve is coming out, and there's 12 cranial nerves on each side, 12 pairs of cranial nerves, and if any of them are squeezed, you get a disease. When the roots of the fifth cranial nerve coming through those canals to the outside get squeezed, you get trigeminal neuralgia, which is very, very painful. Of course, the dentist approach is to give you a root canal, pull the nerve out of there, and the pain's gone, but you still have the problem. And then there's Bell's palsy. The seventh cranial nerve, the facial nerve, is being squeezed. Your face droops. because the roots of the seventh cranial nerve are being squeezed. And then you get ringing in the ears, tinnitus, or tone like that. And that's because the auditory branch of the eighth cranial nerve is being squeezed as it comes out from the brain through the skull. And, of course, you can also get what's called Meniere's disease. I like to rename it to Wallach's vertigo because I figured out what causes it. The vestibular branch of the eighth cranial nerve is being squeezed, and that results in this sort of motion in the room kind of thing or on the boat, a little nausea, kind of motion sickness. And you take the 90 essential nutrients and the secret sauce we call glucogels, as we call the whole package together for these types of things, the Healthy Bone and Joint Pack, and it will support and promote maintenance repair of cartilage, ligaments, tendons, connective tissue, disc between the vertebrae, bone makes its bone itself. And again, I urge you to get hold of the books, Epigenetics, The Death of the Genetic Theory of Disease Transmission, the book Dead Doctors Don't Lie, and the book Rare Herbs and Cures, and you'll learn about all this stuff. Okay? Well, stick with us. We're going to be back with more Truth, Justice, and the Longevity Way on Dead Doctors Don't Lie after these messages. Okay, Doug, what pearls of wisdom do you have for us?
I thought we'd talk a bit about antidepressant drugs, as I have a story here from Natural News headlined, Antidepressant Psych Drugs Likely Increases Suicides in All Ages, Covered Up by Big Pharma, Documents Reveal. And this is a new review published in the British Medical Journal. Found that among all age groups, antidepressant drugs actually increase the risk of aggressive behavior and suicide, especially in users under the age of 18. A comprehensive assessment of 70 different trials looking at safety and effectiveness of the most common antidepressant drugs revealed that despite the drug manufacturers often claim antidepressants are exceptionally high risk, individuals under the age of 18 who take them have a double risk for suicide. The actual data shows many users and their family members have reported erratic, often violent behavior associated with antidepressant drugs, and evidence continues to mount suggesting that depression sufferers are likely better off skipping the drugs altogether. They say antidepressants don't work in children. That's pretty clear, according to the lead author in the study, Professor Peter Gotch, and he's from the Nordic Cochrane Center. It says, in randomized trials, children say that they don't work for them, but they increase the risk of suicide. They say antidepressant use is skyrocketing despite the lack of long-term safety evidence. Many of the highly publicized mass shootings have taken place in recent years have been linked to antidepressant use, which from a purely observational perspective suggests that such drugs aren't exactly safe. Drug companies tend to downplay these and other horrific side effects, though often information is present in the fine print and the drug package inserts. See, many doctors don't disclose these side effects to their patients, and the consequence of this is nothing short of disastrous. Antidepressant use continues to skyrocket among Western countries, Iceland currently holding the title for the most antidepressant prescriptions of any country in the world. Also on the list, Australia, Portugal, Canada, Sweden, and the United Kingdom. According to Dr. Joanna Moncrief, that is, of the University College of London, says people in the UK are consuming more than 4 times as many antidepressants as they did 2 decades ago, noting that about 4 million Britons currently take antidepressant drugs daily, about twice the number compared to 10 years ago. Man, that's crazy. And, we've often heard that all those drugs, those mass shootings, all those people were taking those psychoactive drugs.
Yeah, they were all, every one of them were under the care of a psychologist or psychiatrist for many years. I guarantee you the psychologists and psychiatrists knew that these guys were in the stage where the meltdown, but they don't want to give up the weekly check, so they said, well, let's double the dose of this drug, let's add this drug. And, of course, the results are disastrous, and when there is a mass shooting, guess what? Do they ever interview the psychiatrist, psychologist? If we put about, say 500 of them in jail, I guarantee you the next week, every psychologists and psychiatrists will be prescribing the 90 essential nutrients, and it's not the guns, it's the psychiatrist that should be put in jail. It's not the guns that cause these problems, it's psychiatrists and psychologists who prescribe these drugs. I've said this forever and ever and ever, and so I'm going to, I normally don't do this, but I'm going to ask for one of those little flourishes here, okay? I don't normally ask for these things, it's usually, because if you go back and listen to all of our programs, every time one of these mass shootings occurs, I've always said that. It's the drugs, the psychologists, psychiatrists, it's not the guns. And so We start putting them in jail. Guess what? They'll all be prescribing the 90s. Just remember, how many nutrients does your brain need? All 90. 16 minerals, 16 vitamins, 12 amino acids, 3 fatty acids. Your brains do not need psychotropic drugs. Your brains do not need antidepressant drugs. They need the 90 essential nutrients. We'll be back with Dead Doctors Don't Lie. I should add psychologists after these messages. Okay, Doug, let's go to callers.
Well, let's head to Georgia. And Tanya, you're on with Dr. Wallach.
Hello, Tanya, you're on the air.
Hello. Yes, hi. I have fibroids, 4 of them, very large, and I've looked at the book that you have, Dead Doctors Don't Lie, and it talks about the sodium, the magnesium, and the E vitamins, and I am taking that, and I'm wondering how long do I need to be on it? Or
sure. Okay, now, how much do you weigh? How much do you weigh, Tanya?
162.
162, and how tall are you?
5'2".
Okay. Yeah, 5'2", I'd like to see weigh 110. So, we need to lose about 50 pounds here. That'll help. And so, do you have any issues? Do you have any history of things like your appendix being taken out, irritable bowel syndrome, diverticulitis, diabetes, high blood pressure, anything like that?
No, I don't have.
Okay.
I do have not high blood pressure, but it's anemia. My cholesterol
anemia.
level is high. What is it? Yeah,
okay, hemoglobin
is high.
Sorry. I missed what you said after anemia.
Cholesterol and hemoglobin.
Okay. Now tell me about cholesterol. What is your cholesterol? What's the number?
223.
223? Okay, 223 is very low. 220 to 270 is normal. You're not taking any statin drugs to lower your cholesterol, are you?
No.
Okay, good. Do not do that. I want you to eat 6 to 10 eggs a day. Okay? Now, when you have fibroids, this means you're getting too many free radicals, which are damaging the very sensitive, smooth muscle in the walls of your uterus. Fibroids are not tumors. Doctors use that word, fibroid tumors, to get you to do surgery and things like that, but it's not actually a tumor. It's actually just free radical damage. It's like a giant liver spot, if you will, on your uterus wall, okay? And so what I need you to do is change everything, because what you're doing is what's happened here is what made you have the fibroids. So absolutely no fried foods, no exceptions. Absolutely no processed meats with nitrates, nitrites. It means no deli slices, sandwich meat, sausage, ham, bacon, bologna, salami, pastrami, pepperoni, jerky, corned beef, Spam. Absolutely no oils, no microwave popcorn. Absolutely no theater popcorn, no olive oil, no coconut oil, no margarines, mayonnaise, selters, and cooking oils, and no gluten. No wheat, no barley, rye, no oats. And you hang on. We'll be back, and we'll tell you what you need to do to deal with this. We'll be back after these messages. Okay, Doug, let's go right back to Georgia and Tanya. Okay, Charmain, are you there?
I'm here.
Okay. Now, what would you do for this nice lady, Tanya, who's 162 pounds, maybe 50 pounds overweight for 5'2"? Her cholesterol is sort of at the low normal. She's anemic, and she has fibroids.
Well, I get her on a gluten-free diet first.
Okay.
And then I get her on, if she doesn't have any other problems, I just get her on a healthy, 2 healthy start packs and get her the Woman's FX.
Okay, Woman's FX.
And the Zerofem.
And the Zerofem, okay. And what would you do for her weight?
Get her ASAP.
Well, there you go. So, Char's exactly right, Tanya. I'd go ahead with 2 healthy start packs, 1 full dose for thing twice a day. That's 1 ounce of Osteo twice a day, 2 scoops of the Beyond Tangerine 2.0 twice a day, and also 3 of the EFA Pluses twice a day. That's the 2 healthy start packs. Then I would also, as Char said, let's see here, throw in the ASAP, 1 dropper full under your tongue 30 minutes before each meal, okay, and leave it absorb through oral tissues. That's going to help you lose a half pound to 2 pounds a day. And then I would also get 2 quarts of the Woman's FX liquid. Take an ounce at breakfast, ounce at dinner. This approaches the fibroid problem from an herbal standpoint. Then I would get 2 bottles a month of the tablets, Shar said, which is the Xerafem, Xerafem, and they're designed from a vitamin mineral standpoint to support the vitamin mineral approach to dysmenorrhea, painful periods, PMS, uterine problems, including fibroids and so forth. But the diet's important. No fried foods, no processed meats, no oils, no gluten. Okay. Doug, we got time to start another one here?
Yeah, we sure do. Let's head to the Bahamas. And Charmain, you're on with Dr. Wallach.
Oh, I got 2 Charmains on. That's cool.
Hello.
How can we help you?
Hi, Dr. Wallach, and hi, Charmain. Yes, sir. I'm calling from the Bahamas, and thanks so much for your show. Hope you get back soon. What I'm experiencing is a sinus infection and hypertension, and some issues with a hernia above my abdomen, above my navel.
Okay. Okay, so you have kind of a high belly button hernia. Mm-hmm. Okay. Any skin problems, any eczema, dermatitis, psoriasis, dry skin?
No.
Okay. Any diabetes or high blood pressure? Well, you did say high blood pressure. You did say that, yeah.
Yes, sir.
Yeah, okay. And do you have any history of asthma as a kid?
No. What has happened is the sinus infection seemed to have lately been draining in my chest and causing, even to the point where I thought I was having heart issues. But I've had the heart ECGs done and different heart tests done, and even injecting the dye into my veins, and they came back fine.
Okay, let me ask you a couple more quick questions here. Let me ask you a couple more questions. Any history of asthma or bronchitis as a kid or a young adult?
No, sir.
Okay, well, hang on. I will need to know what you weigh when we get back, and we'll give you a program after these messages. Okay, that's the trilogy of books, Let's Play Doctor, Let's Be Herbal Doctor, and the Passport to Aromatherapy, and Wall Street for Kids. Let's go back, Doug, to Charmain in the Bahamas. And so, let's see, Charmain from the Bahamas, what do you weigh?
I weigh 275, and I'm 5'10".
Okay. So I would say you're about 100 pounds overweight. Okay, at 5'10", I'd like to see you weigh 175, so 275, we've got to work on that. We have high blood pressure, we have a belly button hernia, and we have chronic sinus infections. So Charmain from Michigan, what would you do for Charmain from the Bahamas?
I would get her on a gluten-free diet. It sounds like that's what she's got. And get her on, if she doesn't have anything else wrong with her, I'd just get her on a gluten-free diet, get her on a healthy start pack based on her weight, 100 pounds of body weight.
Okay, so there'd be 3 healthy start packs, okay, per month. Now, if that's financially untenable, you don't get any lower than 2 because you're not going to see much result, anything lower than 2. And so I would go ahead. Optimally, you would take 3 healthy start packs per month. It'll be 1 ounce of the OsteoFX at breakfast, lunch, and dinner, 2 scoops of the Beyond Tangerine 2.0 NutriCrystals at breakfast, lunch, and dinner, 3 of the EFA Pluses at breakfast, lunch, and dinner, all to be accomplished by the 3 healthy start packs per month. And what would you do for the high blood pressure?
For the high blood pressure, I get her on the Daily Classic, the Niacin Plus, and the Cardio Sticks. Okay,
the Ultimate Daily Classic, you're exactly right. And I'd have you take 12 a day, Charmain, from the Bahamas, before breakfast, 4 at lunch, for dinner. And that'll all be accomplished by taking 4 of those tablets at breakfast, lunch, or capsules at breakfast, lunch, and dinner. And then, as Shar said, the Ultimate Cardio Sticks, I'd go ahead and take, I'd go ahead and start out with 2 of those a day, 1 at breakfast, 1 at dinner time. They come in boxes of 30, so it'd be 2 boxes a month. I'd also have you take the Niacin Plus. I'd go ahead and take 2 at breakfast, 2 at lunch, and 2 at dinner time. That'd be 3 bottles a month of the Ultimate Niacin Plus. And let's see here. That'll be the high blood pressure stuff. And then for the weight, the ASAP, I'd get 2 bottles, the 2 dropper bottles of the ASAP per month. If you can only afford one, start with 1. But ideally, you would need 2. Put a dropper full under your tongue 30 minutes before each meal. Put a second dropper full under your tongue 15 minutes before each meal. Let it absorb through your old tissues. It might take a minute or so to make that happen. If you swallow it, it won't hurt you, but you won't get maximum benefit. Give us a call every couple of weeks. Let us know what your blood pressure is. Let us know what your weight is. Let us know how things are going. And for the belly button hernia, as you lose weight, that's going to take a lot of pressure off that hernia. But I would get one of these Velcro trusses that you can wear on top of the hernia and cinch it up pretty snug. And as you lose weight, you'll have to keep cinching up snugger and snugger and snugger. And certainly you want to put a 1-inch board under the feet of your bed so your feet will be maybe 1 inch higher than your head, and that'll take a lot of the weight away from that belly button hernia. Okay, Doug, let's go to a caller.
Let's head to Costa Mesa, California, and Mark, you're on with Dr. Wallach.
Mark, you're on the air.
Yes, doctor. There's a product in the store. It says gluten-free oatmeal. What's your comment about that?
There is no such thing. There is no such thing, gluten-free oatmeal. Somebody needs to go to jail on that one. Oatmeal has a protein that they name gliadin. And when you do an analysis of it, it's gluten. It's just exactly like wheat, barley, rye, and oat gluten. It's just they gave it another name. And, you know, it's kind of like saying, well, I'm not going to shoot myself with a bullet. That's fatal. I'm going to shoot myself with a projectile. Okay? You know, it's just a different name for the same thing. And so you need to let your friends and loved ones know that that's a misuse of words is what it is. Okay? There is no such thing as a gluten-free oatmeal. Okay? That's one of those screaming things you want to say. I'd stand there in the aisle. If I had time, I'd stand there in the aisle at least an hour a day. When somebody goes to grab it, I scream and say, it's not gluten-free. That's a lie. Okay? Good question, Mark. Thank you. Okay. Doug, let's go to callers.
Well, let's head to Monterey, California, and Craig, you're on with Dr. Wallach.
Hello, Craig. You're on the air.
Hi, doctor. Thank you for taking the call.
Sure.
I have a question about my pet. She's a 14-and-a-half-year-old Alaska Malamute mix. She's 95 pounds. She's a real tall dog. She was a year ago diagnosed with renal disease, and about 8 years ago she had 2 TPLOs on both of her front knees. And
what's the TP?
Oh, they took her in her knees. They did surgery, and with the the tendons and things like that weren't working properly, so they had to cut her and fix those. And
okay, so what's a TPLO? I don't even know what that means.
That's what they called it. That's what the vet called it, so I don't know.
Okay, now this is on a rear leg or the front legs?
Both front knees.
Okay, on the front. Okay.
Yeah.
All right.
And she had a small cancerous skin growth tumor on her foot, and that was taken off, and she's been fine since. So, the vet just said get her on a commercial diet, prescription food for low phosphorus and no sodium, and drink lots of water. That was their...
Oh, it sounds like this is a medical doctor treating the dog, not a veterinarian. Oh, my gosh. Okay. All right, 100-pound dog. Char, what would you do for a dog with kidney problems, Char?
A dog with kidney problems, I would do the same thing as I would with a human. I would give it the ultimate daily classic, the niacin plus, and the cardio sticks.
Very good. And what basic supplement would you give as a core supplement?
The Arthrodex, of course.
Oh, Arthrodex, very good. And 95 pounds would be 4 scoops a day. It's 1 scoop for 25 pounds of body weight. So you're going to go through a couple of canisters a month. You get the perfect multiple for that dog. And I would also get a bottle of the EFA Pluses so the dog can have 2 or 3 of those a day, the EFA Pluses. That's for the omega-3s to prevent blood clotting. And Char is exactly right. For the kidney failure, I would throw in the Ultimate Daily Classic tablets. I'd go ahead and get 1 bottle a month and give that dog 2 of those twice a day, 2 at breakfast, 2 at dinner time. The cardio sticks, I'd go ahead and 1 box a month, and go ahead and sprinkle that powder into the food. And then the Ultimate Niacin Plus, I'd go one in the morning, 1 at night. And this is going to support healthy blood flow through obstructed arteries in the kidneys. Make sure there's not a lot of oils in the commercial dog food you get, because oils in the dog food oxidize. Even a lot of times they will put in antioxidants. They'll still oxidize, or they were oxidized before they got there. They contain trans fats, heterocyclic amines. Don't give the dog any bacon grease. Don't give the dog any deli slices or sandwich meats or table scraps that have oils in them. Otherwise, this will be a tough road to hoe. But we can get the kidneys functioning better with this diet and with this supplement program. Okay, here, let's see here. Do we have time to start another one here?
No, we're just about at break time here.
Okay, well, I'm going to remind everybody, get a hold of that new book out, Epigenetics. It's the #1 bestseller, according to Amazon. It's in obviously the name Epigenetics, the death of the genetic theory of disease transmission. In addition to dealing with diseases that are said to be genetic, it also deals with diseases that are falsely said to be autoimmune. It tells you how to prevent birth defects and how to get rid of literally hundreds and hundreds of diseases. Epigenetics, the death of the genetic theory of disease transmission. #1 bestseller. You should have it. Great present to give to everybody else for things that need presents. Well, stick with us. We'll be back with Dead Doctors Don't Lie for these messages. We're back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for Youngevity, 9 for Life Crusade. And Doug, let's go to callers.
Let's go to Idaho. And Kathy, you're on with Dr. Wallach.
Hello, Kathy. You're on the air.
Dr. Wallach.
Hi.
Hi, Dr. Wallach. Thank you for taking my call.
Yes, ma'am. How can we help you?
I first got started on Youngevity products a couple of years ago when my mother was diagnosed with cancer, and she has passed away. I started taking the supplements last summer, and I've gone off all of my prescription drugs for blood pressure and cholesterol. And
how many drugs were you on?
Now I've been What's that?
How many drugs were you on?
I was taking 2 blood pressure medications, a cholesterol med, and a antidepressant.
Okay, so I count 4. And how long had you been on those medications?
Over 15 years on the blood pressure.
Okay, so 15 years on some of them. And how long did it take you to get off of them using the supplement program from Youngevity?
I started taking the products in September of 2014, and I went off all of them in probably 8 months' time.
Fantastic. Thank you so much for sharing your testimony. How can we help you today?
I've been diagnosed with breast cancer.
Okay. And let's see, how long ago were you
I
diagnosed?
want to know what I can... Pardon me?
How long ago were you diagnosed?
I was diagnosed the 1st of December.
Okay. How much do you weigh, Kathy?
I weigh 170 pounds.
And how tall are you?
5'1".
Okay, 5'1". Okay, we need to work on that. 5'1". I'd like to see you weigh 100 pounds, 105 pounds kind of thing. So we need to lose about 65 pounds or so. Okay, now, Char, what would you do for Kathy? She's got breast cancer here. She's 65 pounds overweight maybe, and we need to work on this. We have a life-threatening situation here. What would you do for her?
I would get her on 2 healthy brain and heart packs, and then I would add the Ocean's Gold for the sea cucumber, and I would add the Fucoid Z for the algae, and probably take some extra selenium too. And then she needs to clean her diet up, of course. No gluten, no burnt animal fat, none of the bad stuff.
No fried foods, no processed meats or oils, no burnt foods, and particularly no burnt meats, no oils, as you say, and then absolutely no gluten, no wheat, butter, and oats. 2 healthy brain and heart packs, 1 full dose of everything at breakfast and dinner time. And the Fucoid Z, we're talking about, let's see here, that are capsules. She'd want to take 5 of those twice a day. That's, I don't think, maybe 3 bottles a month to pull that off. They're capsules. And also, you said the Ocean's Gold for the sea cucumber. I'd go ahead and take 3 of those twice a day. That's 2 bottles a month. And what would you do for antioxidant points to really ramp up on the antioxidant points?
Antioxidants?
Yeah. How about BTT, Beyond Tangerine, tablets? Go ahead and take 3 of those twice a day, right? And that'll get you up over 320,000 ORAC points a day. And that's what you want here. And these things are survivable, but you're going to have to be obsessive. This is going to have to be the goal of your life, is to make your diet perfect. Everybody in the household, including the dog, the cat, the bird, the fish, spouse, mother-in-law, renter, kids, brothers-in-law, everybody in the household is going to be totally drop-dead gluten-free, so you're not getting cross-contamination in the laundry, the food preparation services, and the couches where people watch TV, the beds where you sleep together. All that's got to go. And then you have to be obsessive about the supplement program. And what would you do for her weight, Charmain?
Well, I give her the ASAP.
ASAP, 1 bottle of ASAP per month, a dropper full under your tongue 30 minutes before each meal. And within a couple of days or a week or so, you'll begin to lose a half a pound to 2 pounds a day. And the magic is you'll never gain the weight back. Give us a call every couple of weeks if you would, Kathy, and keep us up to date as we go along here. Okay, well, thank you, everybody. Great testimonies today, great questions. Thank you much, Char. Super job as usual. Thank you so much, Doug and Richard. Superlative job as usual. God bless each and every one of you. God bless our troops. God bless our Navy SEALs. And God bless America.
Hi everyone, Andy Anderson here. Are you using those handy little bottles of gel that zap germs, bacteria, and other nasties? In today's world, that's smart, especially with all the filthy doorknobs, shopping carts, and handrails we touch every day. Here's what you may not know. Once the alcohol evaporates, goodbye effectiveness. No more protection until you use it again. PureWorks to the rescue. Our FDA-compliant foam, lotion, soap, and spray do not rely on alcohol. Their killing power lasts up to 4 hours. PureWorks disinfecting spray is EPA certified to kill swine flu, bird flu, MRSA, HIV, hepatitis B and C, and a whole host of viruses and bacteria. Mold and fungus too. It's even safe around children and pets. You'll love the soft feel of PureWorks on your hand. It actually conditions and will not dry your skin. Here's a little peace of mind knowing your hands are still germ-free hours later. Get your hands on PureWorks and get PureWorks on your hands. Stand by. Pull out your paper and pencil for your local number to order. PureWorks.
Foods cause you to bloat or experience gas? Do you wake up in the middle of the night with heartburn? Are you forced to sleep on piles and piles of pillows to cut down on heartburn? Have you been diagnosed with acid reflux or gastroesophageal reflux disease? If any of these describes you, then you've got digestive problems. I was awakened with heartburn almost every night for over 20 years. Then I heard Dr. Wallach and realized all of the antacids I'd been using were actually part of the problem. My stomach acid wasn't too strong, it wasn't strong enough. So I started taking the ultimate enzymes from Youngevity. Now all of the heartburn, belching, and bloating are gone, and I can sleep through the night without piling on the pillows. And I'm back to eating the spicy foods I love. If you'd like to learn more about nutritional supplementation, call your local Youngevity associate, and don't forget to ask about home-based business opportunities.
Virtually every sector of the economy has slowed to a snail's pace. Huge publicly traded companies are laying off thousands of employees. Believe it or not, even the government is letting people go. However, one business industry is thriving, and that's healthcare. Pharmaceutical and health insurance companies are posting record profits in a near-depression economy. Americans are sicker than ever, and those companies are profiting like never before. You too can get involved in healthcare for just a one-time sign-up fee. Youngevity is building an army of associates dedicated to saving America. Dr. Joel Wallach has educated thousands of people on the concept of do-it-yourself healthcare. With a little education, much of what is done in a doctor's office can be done simply and safely at home. Join Youngevity and help save America. If you'd like to learn more about nutritional supplementation, call your local Youngevity associate, and don't forget to ask about home-based business opportunities.
You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and Youngevity products have changed their lives. If you're now convinced that Dr. Wallach is onto something and you want to try Youngevity's premium quality products for yourself, we can connect you with a distributor that serves your local area. Simply call our special helpline voicemail at 313-444-3600. 3463. That's 313-444-3463. Call right now and leave your name, telephone number, or email address, and we'll see to it that the right person contacts you shortly. Remember, the phone number, 313-444-3463. That's 313-444-3463. Call now to change your life. That's 313-444-3463. You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and Youngevity products have changed their lives. If you're now convinced that Dr. Wallach is onto something and you want to try Youngevity's premium quality products for yourself, we can connect you with a distributor that serves your local area. Simply call our special helpline voicemail at 313-444-3463. That's 313-444-3463. Call right now and leave your name, telephone number, or email address, and we'll see to it that the right person contacts you shortly. Remember, the phone number, 313-444-3463. That's 313-444-3463. Call now to change your life. That's 313-444-3463.
Hi, this is Dr. Joel Wallach, your host of Dead Doctors Don't Lie. If you're interested in a colon cleanse, blood cleanse, liver cleanse, in the classical herbal way, you want to ask your Youngevity associate for Herbal Rainforest. Herbal Rainforest has 16 herbs, 16 cleansing herbs, classic cleansing herbs, and 77 plant minerals. That's right, and these are all organic. It doesn't get any better than that. In your busy day, and you're around all these toxins out there in your workplace, on the way home, going to work, in your food, in the air, in the water, you need Herbal Rainforest. I guarantee you, it will give you a cleanse. You can control the dose. It's a liquid. It tastes good. It doesn't get any better than this. A colon that's happy makes you happy. Nothing better than a happy colon. Herbal Rainforest. Clean it out.
For more information on this product or others you've heard about on the Dead Doctors Don't Lie radio program, call your local Youngevity associate today. And don't forget to ask about home-based business opportunities.
Greetings, everyone. Judy DeVilbus here. What do you think of when you hear the words tangy tangerine? Well, I think of like a sweet, tangy tasting something. Well, what I'm referring to is the Ultimate Tangy Tangerine. It's a fantastic product. It has everything you need, and a great benefit is it's very, very delicious. It's very easy to drink. I've suggested it even to youngsters. Even children like it. Even little guys. Even little girls. They come right into my office. Their parents can't get them to take those chewable, and besides that, they're not as good as tangy tangerine. And I give them a little taste of that, and you know something? They're pleased as punch. So, if it's good for a child and it tastes delicious, why not you? There's no excuse not to take a vitamin when it tastes as good as that does. So how about it? Tangy tangerine should be the answer to all of your nutritional program problems.
For more information or to order, call your Youngevity distributor today. And don't forget to ask about Youngevity home-based business opportunities. So you finally decided to start taking a vitamin supplement. Those chewables and tablets are fine if you don't mind paying for something that is only absorbed about 4 to 6%. However, a liquid supplement can have a 90% absorption rate if you choose the right one. Youngevity offers a wide variety of liquid supplements with a 90% absorption rate or more. Beyond Tangy Tangerine may be the best one ever invented. It starts as a liquid that is freeze-dried like those instant coffees into a crystal. Then all you have to do is add a couple of scoops to water. No refrigeration, no fuss, no mess. Not only do you get a complete multiple vitamin, Beyond Tangy Tangerine also has minerals, and it tastes fantastic. You'll want to drink it all day long. So the next time you reach for a vitamin supplement, reach for Beyond Tangy Tangerine from Youngevity. If you'd like to learn more about nutritional supplementation, call your local Youngevity associate, and don't forget to ask about home-based business opportunities.
With increasing rates of osteoporosis, it's becoming more and more evident that most Americans have low blood levels of calcium. Some would say,
I get all the calcium I need from dairy products.
Unfortunately, that's just not true. Besides, most dairy products are homogenized and can contain steroids and antibiotics that kill off good bacteria in the digestive system. Not to mention, the human body needs magnesium to make use of dietary calcium. That's why Youngevity developed OsteoFX Plus. containing bioavailable plant-derived forms of vitamin D3, calcium, magnesium, zinc, copper, and glucosamine sulfate. OsteoFX Plus is formulated to support healthy bones and joints. Not to mention OsteoFX Plus tastes great, unlike other products that taste like chalk or dirt. If you'd like to learn more about nutritional supplementation, call your local Youngevity associate, and don't forget to ask about home-based business opportunities.
You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and Youngevity products have changed their lives. If you're now convinced that Dr. Wallach is onto something and you want to try Youngevity's premium quality products for yourself, we can connect you with a distributor that serves your local area. Simply call our special helpline voicemail at 313-444-3463. That's 313-444-3463. Call right now and leave your name, telephone number, or email address, and we'll see to it that the right person contacts you shortly. Remember, the phone number, 313-444-3463. That's 313-444-3463. Call now to change your life. That's 313-444-3463. You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and Youngevity products have changed their lives. If you're now convinced that Dr. Wallach is onto something and you want to try Youngevity's premium quality products for yourself, we can connect you with a distributor that serves your local area. Simply call our special helpline voicemail at 313-444-3463. That's 313-444-3463. Call right now and leave your name, telephone number, or email address, and we'll see to it that the right person contacts you shortly. Remember, the phone number, 313-444-3463. That's 313-444-3463. Call now to change your life. That's 313-444-3463. 3463.
I am Judy DeVilbus. Here I am speaking to you again. I just wanted to tell you that recently I started drinking the Whey Shakes again, the chocolate Whey Shake. And you need to remember, the Whey Shake isn't just for losing weight. It's a fantastic place to get your great protein. And if you're trying to gain weight, you can take it along with your meals. And the best part is, if you want to just have a great protein shake, do like I do. Put it over ice, stir it up, and you can sip on it for 20 minutes to an hour. I do it every single day. I absolutely love it. You need to get back to it too. It's really good for you. And it makes not fat, but it makes muscle after you work out. And you can also mix it up in a blender with an egg, and you have the most incredible health protein shake. Or mix it with a little water, stir it up, and you have a little pudding. And who doesn't like pudding?
For more information or to order, call your Youngevity distributor today. And don't forget to ask about Youngevity home-based business opportunities. Good liver health is vital to your overall health. Did you know the liver is the largest gland in the body? Generating digestive enzymes, converting fat into fuel, controlling metabolism, regulating cholesterol in the blood, and neutralizing toxins and waste products. Decreased liver function can lead to debilitating diseases. Hepal, a proprietary blend exclusive to Prohoba International, can help support healthy liver function. Hepal is a blend of natural organic pollen extracts, including essential enzymes, botanical glutathione, which is considered to be one of the most powerful antioxidants for detoxifying free radicals and exogenous compounds, superoxide dismutase, and aloe vera, formulated to cleanse and support healthy liver function. If you'd like to have healthy liver function, call your local Youngevity distributor today, and don't forget to ask about home-based business opportunities.
Through his research as a veterinarian, Dr. Joel Wallach discovered that most health problems afflicting livestock can be prevented and even reversed. Many of these same health challenges also occur in humans. These too can be prevented and reversed. Doc's original formula, called the pig arthritis formula, alleviated all arthritis symptoms in animals. The same basic formula has been developed for humans, called the Pig Pack, which includes plant-derived minerals, a multiple vitamin complex, glucogel, and EFAs. Add to that Youngevity's OsteoFX Plus, a proprietary blend of liquid calcium, magnesium, and glucosamine. Now you have the Pig Pack Plus to make up the 90 essential nutrients Dr. Wallach has identified as necessary for sustained good health and longevity. If you'd like to learn more about nutritional supplementation, call your local Youngevity associate, and don't forget to ask about home-based business opportunities.